Hey guys, welcome back to the channel. I'm Dr. Dawson, and today I wanted to talk about why you may or may not want to spay and or neuter your bunnies. The reason that I'm bringing this to your attention is, even though I've mentioned this in a few other videos, I think it's very important to take a little bit deeper dive into some of the pros and cons of why you may or may not want to do this. So number one, let's talk about the pros. So the pros to spaying and neutering your rabbits can be a little bit different based on if it's a spay or if it's a neuter. The reason you would want to spay your bunny is a few. Number one is somewhere around 80% of female rabbits are going to develop uterine cancer. There was one study that showed that uterine cancer had an 80% prevalence by age 3 in the rabbits that they studied. And that's a huge percentage. There's almost no other species that I know of that's going to have one specific type of cancer at such a young age and almost ubiquitous across the species. Now, there might be some genetic component and breed disposition to this being more or less common. And although they all had cancer at, about age 3, that doesn't mean that all of them would have died at age 3 or 4. Many of them may have lived to be 6 or 7. But inevitably, it would have decreased their lifespan. And it may have decreased it dramatically, or it may have decreased it just slightly. But it's something really important to think about is, with such a high prevalence of uterine cancer in your bunnies, especially female rabbits of the European descent, probably worth getting them spayed. The second reason you may want to get your rabbit spayed is that they tend to be a little bit less territorial towards other rabbits and other animals. And often with the decrease in hormones, especially if it's earlier in life, they tend to be a little bit sweeter and a little bit more loving. Not that there aren't loving rabbits that are intact, but there is a trend for them to be a little bit better behaved and have a little bit better temperament if they are fixed a little bit earlier. Number 3 is so that you don't have any accidents. So if you have multiple rabbits, especially if one's a male and one's a female, you really don't want any baby bunnies if you aren't planning on them. They can be a lot and a handful to take care of. We don't really want, if we can help it, to have lots of free rabbits going to free people who will just take advantage of free and then don't take care of their bunnies. So responsible breeding and picking where your bunnies are going to go to is very important. And if you're not in a place to do that, then getting your rabbit spayed can be super important. As for neuters, the number one reason that you would get your rabbit neutered is the fact that it will decrease drastically the amount of spraying and behavioral problems that your bunny will have. Almost ubiquitously, male rabbits will start to spray as they age, usually past 4 to 5 months. That's typically when they'll pick up that behavior where they spray urine on everything. That can be really a pain, and it will probably end up with your bunny being outside in a less clean environment and really not interacting with you as much as you hoped. Number 2, sociability. So bunnies that are neutered are much more likely to get along with other rabbits and get along a lot better. Not that it's 100%, but it is definitely an improvement for how well they get along. So what does a typical spay procedure look like in rabbits? Well, it tends to be a little bit different than dogs and cats, and it tends to be a little bit more difficult than either of these as well. And the biggest reason that there's this difficulty is the fact that rabbits, unlike dogs and cats, tend to have very, very thin skin and thin body wall. The other risk is that their intestines are very fragile compared to a dog or a cat. So there's a little bit higher risk going in for surgery that something goes wrong. The other reason is anytime you put a rabbit under anesthesia, they have a higher risk of something going wrong compared to a dog or a cat. And this is one, because they're extremely difficult to intubate. And an intubation procedure is where we place a rubber or silicone tube in their trachea to make sure that they continue to breathe and we have good access to the airway if anything were to happen. In rabbits, we have a lot more difficult time doing this procedure because there's not a lot of room to see down all the way to their larynx or their throat, where the difficult part starts. Now, what does a typical neuter look like in rabbits Well, it's very simple. It's a very simple procedure. It's a relatively low risk even compared to a rabbit spay because one, we're not entering the body wall typically, and two, both of their testicles are right there and easy to get access to. And although the anesthesia is still there, the anesthetic time is going to be dramatically less, and so our risk under anesthesia is going to be much less significant than it is for a spay. So what does a typical rabbit neuter look like? Well, the testicles are right there. They're super easy to get to. You don't have to go through the body wall to access them. And typically recovery goes very well. Anesthesia is a little bit lower risk than a spay because the anesthetic time is a lot lower. And so really a neuter is almost a no-brainer. There's almost no reason not to, as long as your rabbit isn't being used for breeding. So what are some of the cons of getting your rabbit spayed or neutered? Well, the obvious one is their genetics are a dead end. There's no more going forward. There's going to be no more progeny. One of the other cons to specifically spays is just a little bit of a risk going under anesthesia and having that surgical procedure done. And although it's a little bit higher than dogs and cats, it's not dramatically different. The difference is probably somewhere between cats and dogs being 1 to 2% risk, whereas rabbits are probably more like 3 or 4%. So a little bit higher, but not bad. One of the other cons is that especially if you're going to do it later in life, the benefit may be a lot less than if you did it earlier in life. So if they are 3, 4 years old, your benefit is going to be a lot less than if you did it when they are 12 weeks to 24 weeks, somewhere in there. So if you guys are thinking about getting your rabbit spayed or neutered, here's a few things that you should know. One, make sure that the vet you're going to has done these before, and not every vet is going to have had that, and if you can't, that's okay. But if you can, go to an experienced rabbit veterinarian, as they're going to have a lot higher chance of doing things right and a lot lower chance of having any anesthetic or surgical complications. The other thing is always bring your rabbits food to the appointment and make sure they're eating up until about an hour before the procedure. So if they're going to be there and it's just going to be drop off in the morning, make sure you bring them food, and hopefully the veterinarian and their staff will keep food available to them until a half hour to an hour before they go to surgery. And the other thing is that when they wake up from surgery, we want them to have access to food as soon as they're able to eat. And the reason for this is that once they undergo anesthesia, they're at a little bit greater risk for GI stasis. If you want to learn more about that, you can find a link up here. So making sure that they have food and getting them eating as quickly as possible is very important. The other thing is, afterwards, post-op, make sure that your pet has some good pain management. So if your vet doesn't offer it, at least talk to them about doing some pain management strategies, as they're a lot more likely to start and continue eating than if you don't. And they're also going to be a lot more comfortable. Also make sure your rabbit has some sort of cone or something to make sure that they're not licking and or chewing at their incisions. I had a bunny of my own whose name was Valor, who actually chewed open his incision from his neuter. And the reason that he did this is he jumped and caused a hematoma to form, or a big blood clot. And that got very itchy. And so he went after it and started chewing at it and caused a lot of trauma, and it was a lot of recovery time. And there was nothing that the vet did wrong, it was very unlucky, and we had to keep a cone on him for almost a month instead of the typical 10 days or so that we would have probably started with if we'd started with a cone. One other thing to think about is if your vet has laser, that's a very good thing. The trauma is going to be a lot less dramatic, and it's a really, really good tool for doing these procedures. Our practice currently doesn't have one, but it's something that we're hopefully in the future going to be working on getting for these kinds of procedures to, 1, increase our speed, and 2, decrease the amount of blood loss during these procedures to minimize our risk of being under anesthesia and our risk for surgery. I hope you guys enjoyed this video, and if you have questions about rabbit spays or neuters, my experiences with them, leave them down in the comments below and I will be happy to answer. And if you haven't already, hit the like and subscribe button if you want to continue getting content like this or other veterinary related content that we'll continue to push out twice a week on Tuesdays and Fridays. And I hope to see you guys in the next video. We'll see you in the next one.